Hello, lovely viewers. This is the Ghanaian Doctor, and today I'm coming into your homes to discuss polycystic ovarian syndrome. Now, I know that I have a change of location. I'm in Accra to do a presentation on this same topic, which I'll post on my page. But this is just an introductory summary version, which I'll do for those of us who will be wanting to have a quick cursory outlook into the medical condition. Recently, on the 12th of May, the name was changed from polycystic ovaries to polyendocrine metabolic ovarian syndrome. Now, the main reason for this was, polycystic ovaries mainly focus on the ovaries and having multiple cysts or fluid-filled areas in the ovary. However, it's been identified over the years that the syndrome goes beyond the ovaries. It comes with problems with hormones, it comes with problems with fertility, problems with menses, and just focusing on the ovaries and leaving out the hormonal aspects sometimes affects the management and affects the level of care that we provide to individuals who need help from this medical condition. So, over 50 organizations came together, and over the past 14 years, they have fought, and finally, the name has been changed to include the endocrine aspects of this medical condition. Let's go a bit deeper. When you have polycystic ovarian syndrome, PCOS, or now PMOS, what happens is that there's an increase in the level of androgens or testosterone circulating in your blood. This is usually associated with infertility, irregular or absent menses, and sometimes, not always, cysts in the ovary. Now, this circulating androgens or testosterone is what accounts for most of the symptoms we see in polycystic ovary syndrome or PMOS. Now, these symptoms include having a male pattern distribution of hair, like having a beard, a lot of facial hair, having hair on your back, hair on your abdomen, your stomach, along the middle of the stomach, similar to a male distribution pattern, having a deepened voice, having an increased muscle mass, and becoming obese. Now, apart from these symptoms, other symptoms that can come with PCOS or PMOS that are not necessarily related to the high levels of androgen include having an absent or irregular menstruation cycle and also having infertility. The problem with PCOS is that it comes with risk of medical complications. Over 40% of people with this medical condition have insulin resistance, out of which you can get diabetes. Actually, 10% of individuals with PCOS go on to have diabetes. Other medical conditions that can come with PCOS include risk of stroke, risk of clots in the legs and the lungs, risk of heart diseases, risk of hypertension, and so on. During pregnancy, when it's achieved, there's risk of having hypertension in pregnancy, preeclampsia, which is a severe form of hypertension in pregnancy, diabetes in pregnancy, and even risk of early pregnancy loss. All of these complications makes it very obvious that PCOS is a condition that needs to be managed and managed aggressively. How do you know you have PCOS? If you have any of these symptoms I've mentioned, you should see a medical professional who will do a scan of your ovaries, see if there are any cysts in your ovaries. We'll do a blood test to check the level of androgens in your blood. And then also, we will investigate to see if there is any other cause for the symptoms you are having. If it is confirmed that it is PCOS which is causing your symptoms, depending on your symptoms, your doctor will prescribe a particular drug regimen for you. Please remember, different medications are used for different presentations of PCOS. Someone with PCOS causing weight gain will not be given the same medication as someone with PCOS causing infertility. Someone with PCOS causing acne or hirsutism, which is a lot of facial and body hair, will not be given the same medications as someone with PCOS, causing, say, absent menses. This is very important to note so that you do not go and probably ask your friend who has a similar diagnosis of PCOS for her medications because you think it is more effective or otherwise. The medications are classed in three groups primarily. The first group is a medication that causes a control of the hormone, testosterone, or androgens. The second group helps to improve fertility, and the third group helps to improve or modulate the menses. Apart from this, there are lots of dietary changes which have been seen to improve PCOS. Some of them include reducing levels of processed sugars like white sugar, brown sugar, cakes, pastries, and all that, and increasing intake of high fiber diets. High fiber diets include diets like oats, fruits, legumes, nuts, etc. Apart from this, exercise has been seen to improve the symptoms of PCOS up to even 50%. Regular exercise helps to lose weight, to improve the symptoms of PCOS, and helps you feel better. I hope you have learned something about PCOS today. This is a little I'm going to share on this video. If you want a longer version, I've pasted a link to my YouTube video where I present on PCOS at the Prisons Clinic in Accra. Thank you and see you on the next one.